Good morning, everybody. Happy Friday, one day closer to the weekend. And my name is Dr. Philip Ross over at the World of Wellness. And kicking off the speaking topics here at the 9 a.m. For Friday. Last day of the sale tomorrow. So if you're still missing anything, come in, pick up some supplements. And today, basically, what I'm going to be covering is how sports rehabilitation can help you even if you are not a high caliber athlete. Um, so I'm a chiropractor, but I also went for a master's in sports rehabilitation when I was in school, which helped me immensely when it comes to not only treating the athletes, but the everyday weekend warrior. Whether you like to walk, whether you like to go on hikes, whether you like biking, whether you like golfing, we could tailor a treatment plan for you to increase your quality of life depending on what you are doing. So spring, well, apparently we'll see what happens with the weather tonight, but spring should be right around the corner minus the snow tomorrow. And what that means is everybody's getting out and getting active. So um, a lot of the times when people come in, I actually use the sports rehab stuff for people who have like old injuries, like old ACL, old knee replacements, or still having pain doing certain things. So we'll dive into that a little bit later, but basically the topic is going to be how all this therapy can aid you and improve your quality of life just doing everyday things. So again, everything we do is tailored to the patient. So whether it's you're having pain during walking, whether you can't get off the ground comfortably after playing with your grandkid, whether you're scared of taking a case out of water out of your trunk to bring it into your house, everybody sometimes sustains an injury or feels a pain or exacerbates a old complaint depending on what they're doing in their everyday life. So most of the stuff that we go over here with patients, let's just take for example low back pain. One of the biggest keys and one of the biggest tools that we do is we start with intra-abdominal pressure, so the diaphragm. So this goes off of, it's called a DNS, dynamic neuromuscular stabilization principle. So when you look back in fetal development, when you look at an infant, every time you look at an infant, infant's always breathing through their belly. That's that diaphragmatic breathing. They're keeping intra-abdominal pressure. As you get older and, due to any kind of like stress that due to being out of shape, a lot of people develop the chest breathing. So you see them breathing really heavy like this and you lose your intra-abdominal pressure. Why that's so massive is when you keep intra-abdominal pressure, so diaphragmatic like belly breathing, it links up the upper extremity, so your arms with your lower extremity, your legs. That is massive. A lot of people, for example, we'll take the instance of just getting a case of water out of your car because that's actually prevalent how people experience some low back pain. Um, Everything you do, you want to keep the intra-abdominal pressure because it will actually support your low back as well. So just a quick analogy. When you have intra-abdominal pressure and pressure in your abdomen, it will support your low back. Same principle is if you try and crush an empty can of Coke as opposed to crushing a full can of Coke. When you have the pressure in there, it's kind of hard for things to go wrong. So, very, very basic. When we start with anybody with like a lower extremity or a low back complaint, we have a rehab room. We'll go in and we'll work on the intra-abdominal pressure, so the belly breathing. So um, it's actually easier said than done, but what we do is we get you on your back and we actually kind of retrain the brain to breathe through your diaphragm because, again, it's going to support your low back and sync up your lower and upper extremity. So that's done by in the rehab room. We'll start on your back, and there's certain cues that I do, and everybody's different. So, I might say one thing and people respond to that and understand it a little bit better. But basically, what we try and get you to do is breathe through the diaphragm, breathe through your abdomen to support your low back. That's absolutely massive. Even the premier baseball pitchers in the MLB, I know, for example, the Cardinals pitchers, before they even start anything, they start with the intra-abdominal pressure because it's going to support your low back and just sink your upper and lower extremity way more efficiently. So that's absolutely massive. And that is kind of the core of what we could do with people experiencing low back pain. And then after that, once you actually learn how to breathe through the diaphragm and create the intra-abdominal pressure, then we go into core stability exercises. So Dr. McGill, one of the pioneers in physical therapy, he has his big three. So McGill's big three is the planks, front plank, side plank, dead bug, and a bird dog. I like to add a Palloff press in there as well because it could target that multifidi muscle a little bit more efficiently. It's a small muscle kind of in your low back here. Um, so Once we get you breathing correctly, we go into the core stability exercises. This is absolutely massive for anybody suffering from low back pain. People who are sitting at a desk 40 to 45 hours a week, people who drive a lot for work, absolutely massive. Because if you do not have a strong core, your low back is going to be compromised. It's a little bit of the yin yang, right? So, what we do is we teach you how to breathe, and then maybe the next visit we go into the core stability exercises. So, correctly doing a plank with a proper form. And the biggest one that I like is the dead bug. It sounds how it looks, or it looks how it sounds. So basically, you're laying like a dead bug, and you're just moving arms and legs, because when you train the core, you actually want to train it. And the spine is stable. A lot of times you go to the gym, you see people doing windshield wiper exercises, some crazy core stability and abdominal exercises to get those abs. But actually, your core stability muscles, that they're, I mean, if we build the core, it will help to kind of stabilize your spine. So when you do the core exercise, you actually want to do them with a neutral spine. So a stable spine, so you don't jeopardize your spine. Um, so once we kind of go over the dead bug, the bird dog, pal off press, and some of the planks, that is the best way that we could kind of rehab your back. Now, it's pretty common for people to have the low back pain running down the leg. So not only are we going to target the low back because that's the source of the pain, but what we're also going to do too is give you certain specific stretches that you could use to help the radicular symptom running down your leg. So we'll start with the intra-abdominal pressure, the belly breathing. Then we go into the core stability exercises to kind of help build back the yin and the yang, build the strong core to support the low back. And then we go into, I use some principles as well as Dr. Orbach with the McKenzie protocol. So McKenzie protocol is different kind of stretches to increase the length of the nerve. So I like to say we're trying to put more slack in the rope. So if you hurt your back, we're going to rehab the back, make everything strong, cure the back, and then when you feel the pain running down the leg, we will give you all these. They're called neuromobilizations, which is basically just a fancy word for a nerve floss. So we could give you specific exercises to decrease the symptoms into your leg. Absolutely massive. A lot of people will just go straight to the low back and say, oh, the leg will heal up as we heal the back. Very true, but also want to treat both things going on, right? So if you come in, we do most of that stuff as well. Another thing, sports specific rehab doesn't mean that you're just trying to work on balance for if you're a wrestler, if you're a boxer, being light on your feet, baseball, if you're trying to get in a better stance. Very, very commonly, I've had multiple patients come in post stroke, diabetic neuropathy, post concussion. They don't feel right. They don't feel the connection from their brain to their feet. They feel off in their gait, so their walking cycle, and they just don't feel right. So, what we do is we go over, it's called the VALM screen. UPMC brought it up. It's basically it's like a vestibular oculomotor screen. So it's going to assess the brain function to see if it's truly coming from the brain, why you can't have the connection with your feet. So we go through the VALM screen, and then the cool thing is we have stability disc and we have foam pads back there, and we could kind of tailor a certain balance protocol for you to come in and basically train. So a lot of people with the post stroke, they don't feel right on their feet, so to speak. And I'm actually working with a patient right now that he'll come in for the treatment on Tuesday, and then on every Thursday he'll come in, and we will actually be in the rehab room doing certain exercises to kind of help bring back his leg that he suffered in the stroke. It's weaker than the other side. So we do a lot of. It's all tailored to the patient. It's all specific to the patient. So um, going in line with the diabetic neuropathy. So not only are we going to, provide nutritional support and supplementation to help with the symptoms of the diabetes, but we're also going to use the laser therapy in the room and specific balance exercises so you can create the signal from your brain to your feet, better connection so you feel more comfortable in your own skin. Great results with that. I know it sounds weird. You're going to go to a chiropractor because you think you're just going to get your back adjusted, neck adjusted, extremities, whatever. But that's a fun part about my job. I love going in the rehab room after people are out of pain and they're feeling better. Wow, I feel my feet a little bit better. I feel better when I'm hiking. I feel better when I'm walking on a trail. And then going in the room and just concreting that, just doing different kind of exercises to link your brain up with your feet so you feel more comfortable in your own skin. Very, very fun to do. Also, multiple concussions. So, um, crazy, crazy results with this one patient. So, he was an old hockey goalie. Three concussions back to back to back. He was out of commission for a while. The first time I met him, he was 19 years old, came in with a cane, came in with sunglasses. When he came in the room, had to turn the light off, sound off, everything. He was very, very sensitized to everything because his brain was firing like crazy. Um, Long story short, we were in the room. We treated him, and then we started to do different vestibular exercises to kind of help his brain link up with his legs again. When you see a 19-year-old coming in with a cane, that shouldn't be happening, right? So I've actually been treating him, and then he has actually been going to Atlanta to see another chiropractic neurologist named Dr. Duffy. And co-management wise, Phil, I'm sure you've seen him when he comes in. No sunglasses, hasn't brought a cane in a while. Yes, and he comes in smiling. And he comes in, he has an occasional flare up of a headache, but the coolest thing is, from not being able to exercise, from not being able to watch TV because he would get massive headaches, he is now walking. And he just said 2 weeks ago when he came in that he is actually able to sustain a run, like a jog, for 10 to 12 minutes. And he's back in the gym exercising. Unbelievable results. We also put him on the brain boost and the magnesium, which definitely help with the neurotransmitters in the brain. But absolutely crazy results. That was probably one of the funner ones I worked with. Yeah. Unbelievable. Yeah. When he first came in, he had a cane and sunglasses. It's ridiculous. And now he's going on jogs almost every other day. So that's absolutely massive. So if you think that you have multiple concussions, diabetic neuropathy, if you have any kind of post stroke, if you just don't feel right, and if you don't feel connected from your brain to your feet, and it kind of feels like you're susceptible walking on uneven surfaces, you can't go on hikes, you can't go on walks in the woods because you're scared of losing your balance, come in, we'll run you through the Volve screen, and then we'll actually protocol specific and tailored treatments that you could even do at home, not just necessarily in the office, that you could do at home just to improve your quality of life. Going kind of off of that, so the balance and the vestibular training also goes into, it ties in with what's called proprioceptive training. So proprioception, big word for where your joint feels like it's at in space, is kind of the technical definition. So basically, for example, if you had an old knee injury, say you tore your ACL in your 20s and now you're 50, and your knee feels all right, but sometimes it feels like it's going to give out. Sometimes you have pain when you're golfing, walking up a steep hill, walking upstairs. What we could do is we put you on the stability discs and the foam pads to build proprioception, so it links your brain up to the joint so you feel more comfortable in your own skin. Proprioceptive training goes well. Any kind of post muscle strain, post joint sprain, and any kind of like neuropathy symptom too. So we do a lot of proprioceptive training, do it with the athletes, but not only the athletes, just like we were saying, if you're a weekend warrior and you like going on a hike and you feel like your knee's unstable, come in, get assessed, and we could give you certain cues that you could do in the office that will take you through. And then we could actually give you tailored exercises and stretches you could do at home, just to improve your quality of life. Um, Moving on next to it. So we value HIPAA in here. We really don't say anything that a patient doesn't want being said. With that being said, talked to Dr. Orbach and wanted to share his story. So Dr. Orbach, he said roughly 25 to 30-year-old ankle injury. And we work on each other about once a month. I wish it was a little bit more, but we find time for once a month. And we kind of threw the kitchen sink at him last week. And he came in, he was saying, Doc, I was squatting, and I just feel like my legs caving in when I go down on my squat. He has an old ankle injury, about 25 years old. And not only with the heat from the laser and the grass, then we kind of took him through a couple of different proprioceptive exercises on the stability disc. And he says he feels like his ankle is just feels a cleaner motion now when he's doing squats. So it doesn't have to be, you're an athlete right now and you sustain an injury. It could be that, you used to like to play competitive volleyball in high school, or you were in a golf league in your 20s and you had an old injury and you think, oh, well, I just got to deal with that the rest of my life. Not necessarily at all. If you come in, we get you assessed. Even if you have an old injury, we have fantastic modalities in here that we could use to decrease the inflammation, decrease the pain. And then in the rehab room, what we could do is we could kind of concrete and figure out what muscles are overactive, what muscles are underutilized, and we could kind of come out with a tailored plan to decrease the tension in the hypertonicity, so the tightness of the tight muscles, and then a protocol to strengthen the muscles that are weaker. So just everything's balanced in a more uniform form. So that's what we've been doing with Dr. Orbach in the other room, working on his ankle. And old knee replacements as well. So old ACL tears, old knee replacements. Hey doc, my knee flares up on me 3, 4 times a year, swells up, balloons up. Is there anything I can do at home? Absolutely. So again, come in, we'll get you treated. We'll go through a full assessment to see if you have any muscles that aren't working efficiently, give you tailored exercises that you could do at home to strengthen those muscles. And then when you're in here, when we're treating you, we're going to provide the therapy to loosen up the tight muscles that's kind of throwing everything out of whack. So that's something we definitely do in here as well. And then even if you're not a weekend warrior, you don't like, running the occasional 5K, you don't like going hiking, you don't like playing golf on the weekends. Simple things that sports rehabilitation can benefit you greatly. For example, gardening. I've had, I think it was like 4 or 5 patients come in last year, sustained a low back injury from gardening. So we could go over the proper biomechanics if you're going to be working with anything below your waist, how to keep the intra-abdominal pressure to stabilize your low back, and then properly actually how to lower to kind of get into the garden so you're not compromising your low back. A lot of people just flex at the waist and put a ton of tension on your erector spinae muscles, and then you get muscle spasms in your back and you compromise your lumbar spine. But when you come in, we could go over the postural cues for how to correctly kind of get down. If you want to get down and play with your grandchildren on the floor and you have problems getting up, we could go over different things to give you exercises at home to strengthen. So when you're getting up from playing with your grandkids on the floor, or when you're getting up from working in the garden, that you don't have such significant low back pain. Um, Other ones too, pain in the shoulder, very, very common. Pain in the shoulder when reaching up in a cabinet. So a lot of people, your shoulder is the most mobile joint in the body, most susceptible to injury. So a lot of times people will be like, Doc, I feel good, but when I'm going to grab my seatbelt, or when I go to grab my seatbelt, or when I go to reach in the cabinet, I feel a sharp pain in my shoulder here. Um, I use a lot of sports specific and sports rehabilitation properties when rehabbing that. So, long story short, your humeral head, so the ball in the socket up here, if that's pressed up too high and it's sitting too high, it could put pressure on a rotator cuff tendon coming in and attaching to the shoulder. So, a lot of the times when people are actually reaching up to grab something out of their cabinet, it's shortening. It's shortening the space where that supraspinatus tendon comes in and it pinches it, and then people feel the pain right away, right? So what we do is we'll treat you in the room with the grass and the laser, and then I like to do a lot of scapular stability exercises. So that is basically working on one of the 3 joints in the shoulder, just so your arm moves more efficiently. People respond absolutely fantastic with that. And it's my favorite part of my job is when someone comes in, they've been battling, I've been having off and on shoulder pain 4 or 5 years. It's been really bad the past couple months. Can you help me? I don't want to get rotator cuff surgery. Absolutely. Bringing in your MRI, seeing if you have a full thickness tear or a partial tear, and just doing the specific rehab, and just giving you things you could do at home. So when you're going to grab something out of your cabinet, you're not feeling excruciating pain in your shoulder, and you just have a better quality of life. Another one too, when patients say they have numbness and tingling in their hands. A lot of times people coming in, Doc, I'm working 45 hours at a computer. My hands and my forearms, wrists are sometimes hurting. We do a lot of soft tissue therapy that is all kind of sports rehab, to be honest with you. So it's that pin and stretch. So for example, people who are working at the computer 40, 45 hours a week, your flexor muscles of your forearm tend to get really, really tight, as well as the extensors. So the pin and stretch, basically what we do is what I do with patients and kind of instruct them how to do at home is you want to shorten the muscle. So you're going to shorten the forearm muscles, pin them down, and stretch them back out. And the main reason that we're going to do some of these is because it's going to allow for to elongate the muscle. It's going to allow the muscle to get more elastic and elongate it, so you're not feeling the tightness. I mean, since over the past year, I probably had, I think, 3 or 4 patients who came in. Numbness and tingling in my hands. I think it's carpal tunnel. Okay, you go get an EMG. We see your nerve conduction study, and you have none to mild carpal tunnel syndrome, it's not coming from your carpal tunnel. It's coming from a nerve entrapment in your forearm. So, um, actually, just this week, I was working with an athlete. Post UCL tear and elbow dislocation. It's pretty well the same therapy that we're going to do for that on the forearm muscles that we're going to do for you just if you're typing on the computer and you're having numbness and tingling in your hands. It's basically stripping out the muscles to relax the nerve so the nerve's not getting compressed and it's not firing. So when you have compression on a nerve, it depolarizes the nerve. So the action potential that fires the nerve, that creates the impulse, that gets closer to zero. And then you have the firing of the nerve. So once we do the soft tissue therapy to release the tissues and the pressure on the nerve, the action potential normalizes so you don't have the sensation of the numbness, tingling, pain in your hands. When people come in for that, that's really cool too, because I'll do a grip strength assessment at first. And it's not uncommon that people will go and we'll assess their grip strength. Let's just pick a number. Let's say 80 when they're first coming in, painful. After 4 to 6 treatments, they come in and they're squeezing over 100 pounds, no pain. That is really, really cool to see as well. So, again, you don't have to be an athlete to come in to get some of this therapy. It can benefit you greatly from the numbness and tingling in your hands, low back pain when moving a case of water from your trunk into your house, gardening, going to pick your grandchild up off the floor, and just everything like cooking. I had a lady coming in, elbow pain, picking up a gallon of milk. So she has significant elbow pain right here when curling iron, picking up a gallon of milk, any kind of weight. That is your typical lateral epicondylitis, so your tennis elbow. Even though she's not a tennis player, she still has that pain. So what we do is we assess it, figured out exactly what it was, and now we are treating most of the extensor muscles on her forearm to increase her quality of life and decrease her pain. And yeah, she came in 2 weeks ago. Elbow's completely fine. Said she wanted to start working on her back. So those are some of the stories that I like to hear. Just because it's nice to have this kind of background, but still just be able to treat everyday people and they just get results. Um, Lastly, one of my favorite things is that I do. It is sports specific. You don't have to be, you don't have to have a handicap. You don't have to be, a competitive golfer. Love golfing. I don't know if anybody caught the Players' big rain delay yesterday, but I'm TPI certified. So the TPI certification stands for the Titleist Performance Institute. So I'm a level one provider. So basically, what that does is we go in the room and we take you through the 15 major biomechanical movements in the golf swing and analyze them. So you don't even necessarily have to be in pain. You might be a little bit, if you are in pain, definitely come in. We will definitely get you out of pain so you could golf 18 holes pain free. But even if you're not in pain, you just think, well, when I golf, I just wish I could get my hips around a little bit quicker. Or I feel like I'm lagging up top and I just need to throw my hips. Or you know what, my back feels compromised when I'm setting up to hit for a ball or anything like that, or my ankles kind of bother me when walking up hills. What we could do is take you through the 15 biomechanical movements and we assess everything from head to toe. So we literally work from cervical spine, your neck, all the way down to your ankle to see what kind of motion you have in your joints, to see if we could give you stability exercises to strengthen, or if you are compromise. Like if you can't, if we check, for example, hip internal rotation, very simple check is you're just going to go like this and turn into the affected hip. If you're not getting all the way where we want, we could tailor certain stretches that you could do at home in pre-golf round that will just improve your golf game. That's really, really fun to me because I'm an old soccer player, but I love golfing now. I caught the bug. And so it's really, really nice when people do come in pain and say, hey, doc, I'm having pain golf and can you assess me? We'll get them assessed, treat them a handful of times. They're back out. They feel great. But it's fun when people come in and say they just want to, maybe they want to add 5 or 10 yards to their drive, or maybe they want to feel like they could take the club back farther through their backswing, but they're hurting in their shoulder, old shoulder injury, and they don't have the range of motion they would like. It's really nice to go through the 15 main biomechanical movements of the golf swing, assess them, and then give the stability exercises where needed and do the therapy and stretching in office, and then give you a protocol of stretches that you could do at home just to increase the longevity of your golf game and improve your golf game? Well, results vary. I'm not saying you're going to come in and get treated and shave 4 to 5 strokes off your game. And I'm definitely not a golf pro. I do not, give a golf analysis, or I don't give like golf lessons. But what we could do is, I'm a master of the biomechanical movement. So when you come in, we'll see what moves properly, what does not move properly, and we'll get everything completely balanced. So when you're moving, you just feel like way comfortable in your skin, and you're as optimal as you could be while golfing. So that's actually one of my favorite things to do. The golf screens are very, very fun, and people are getting a lot of great results. So whether it's coming in with pain, can't play hole 18, when they actually come out of pain and they just want to say, you know what, my shoulder feels tight there in my backswing, or again, I feel like I can't rotate through my pelvis and my hips. Great, can we improve some of my range of motion in my hips? Absolutely. Not only are we going to go through the analysis, the 15 biomechanical movements, but we're also going to provide, depending on what your ailment is, laser therapy, grassing, cupping, and then that pinning and stretching works great too. And it's called FST, fascial stretch therapy. So all these different things to improve your golf game, and if you're not in pain, we could do those just so you feel better after a round. So that's kind of like what we do over here, and that's why if you are not an athlete, you could certainly benefit greatly from the care here. Almost everything we do is athletic, right? So even if you like going on just a jog once a month, that's an athletic movement. I mean, that's a single leg squat, basically, in essence, if you're running. So if you're having pain running, or even if you're not having pain running, if you're just running, you say, something feels off, I don't feel all 100% in my own skin. Come in, get assessed, and the therapy we provide for you is going to greatly improve your quality of life. So that's me done rambling here. Does anybody have any questions? Any questions come in? Okay. No. So yeah, guys, thanks for tuning in. Appreciate it. It's nice to kick off the 9 a.m. on the last Friday of the Wellness Week. We have one more day tomorrow. It's going to be 9 to 5. It's going to be crazy busy. Hopefully, we don't get a ton of snow. You could come in, come get some free food, get some supplements, and we will see you in May. When's the next one, Phil? May 14th. So have a great one, guys. Stay safe this weekend, and we'll see you in May. Dr. O's coming up next. Dr. O's coming up next. Tune in to see Dr. Warbach.